Mosaic effects of growth hormone on fibrous dysplasia of bone. Definition: fibrous dysplasia is a rare bone disorder that consists of scar tissue growth instead of normal bone. This irregular tissue can weaken the affected bone and cause it to deform or fracture. In most cases, fibrous dysplasia appears in only one place in a bone, but it can appear in several places of various bones. The condition of a single bone usually occurs in adolescents and young adults. Normally, people who have more than one affected bone have symptoms before their 10th birthday. Although fibrous dysplasia is a genetic disorder, it is caused by a genetic mutation that is not transmitted from parents to children. This disorder has no cure. The treatment, which may consist of surgery, focus of relieving pain and repairing or stabilizing the bones.
The bone to mature and realign along the stress lines. Failure of maturation means primitive immature trabecular bone and primitive dysplastic fibrous tissue. And if you add poor mineralization to this, you will get deformities and fractures. The genetic defect involves a G protein that can affect the cyclic AMP. It usually involves the proximal femur, followed by the rib, the maxilla, and the tibia. It is probably a metaphyseal geographic lesion with a classic ground glass appearance, hazy. It may have no aggressive features, and it may have industrial scalloping, different than neurofibromatosis that have periosteal scalloping. It's usually central, but it can be peripheral. So the histology is fibrous and the osseous component. Sclerosis may be present and depend on the content and the extent of the osseous versus fibrous ratio. It will have irregular spicules of woven bone, which is immature bone, without osteoplastic rimming in a bland fibrous background, giving the characteristic appearance of Chinese.
Application and nursing. In the application within nursing, we can code the following care that we should provide to patients with this type of hormonal thrusting. Restore the physiological well-being of the patient, evidenced by stable blood pressure, heart rate within normal limits, ideal weight balance between intake and elimination. To ensure that the patient can perform their daily activities independently. To ensure that the patient understands and is able to explain the therapeutic plans and measures to face complications. To get the patient to talk about himself is positive there, emphasizing the aspects that counter his deficit. Help him to understand the basics of medication and the change introduced in his diet and hydration. Pros and cons. Pros. Although fibrous dysplasia is a genetic disorder, there is a cause of a genetic mutation that is not transmitted from parents to children. The treatment, which may consist of surgery, focus on relieving pain and repairing or stabilizing bones. Cons. This disorder has no cure. Difficulty walking or limp. Issue in Ecuador. Uncommon of unknown cause, it comprises approximately 2.5% of all primary bone lesions and 7% of all benign lesions that occur in adolescence, predominantly in females and in a quarter of patients associated with precocious puberty and coffee sport with milk on the skin. Conclusion. In my personal opinion, I think that this hormonal disorder that affects the pituitary gland should be treated with great delicacy. The patients who suffer from osseous dysplasia should maintain a good lifestyle, since that way they will be able to take a better treatment in the relief of the symptoms of the pain. It is important to mention that most of the people who suffer from this genetic problem are children, which is why it is necessary to focus on holistic self-care. Finally, the nursing care that can be provided to test patients must be carried out under a scientific background so that results in their recovery are satisfactory.